You know, the older we get, of course, it's just part of life. Different health issues come about. You know, a lot of times you go through life just doing just fine, but others, well, you might have some different issues they have to deal with, especially when it comes to circulation and in your legs, and they start getting those veins that show up. Dr. Hasim Barmada at the Vein Center, how are you? It's good to see you again.
Thank you.
We've been here on several occasions talking about, your veins and everything. And it's true, and there's different conditions that can contribute to us having the vein problems. So talk about that a little bit.
Yes, sure. Well, first of all, there are a number of factors that actually cause varicose veins and chronic venous insufficiency, which is the name, the proper name for varicose veins. Heredity is very, very important. Job qualities and what you do at your job, whether you stand for long periods or sit for long periods, more than 5-6 hours a day, then that would be very, very important as a contributory factor. And of course, pregnancy is very, very important. Many ladies point to pregnancy as being the time when they actually began to see the varicose veins. Being overweight is very important because that compresses the veins and the venous and the lymphatics that come back from the legs into the body and the heart, and that increases the hydrostatic pressure, and therefore it would contribute to varicose veins. So these are the main factors, and of course there are other factors.
Well, the older we get, the less the less active we are. So as you said, sitting, standing, or whatever, moving around is going to contribute to causing some of those problems with varicose veins.
After the age of 25, everything begins to deteriorate very gradually. We lose about 1% of our potential every year. So from 30 to 70, 40 years, we lose 40%.
Wow.
And that deterioration will actually affect the veins too. So as we grow older, the ability to maintain the integrity of the veins also decreases. So we will tend to have more varicose veins, more heart disease, more everything.
Now, I'm going to pull this up here real quick. This is a little chart on the venous system that shows exactly the different things that you have to look for. It talks about the blood flow and the things that can cause some problems for you.
Sure.
And can cause some health issues down the line.
Absolutely. The main one which worries most people is clots. Clots in the deep system, because they can be clots in the deep system as well as the outer system. Okay, if you look at the picture over here, there is the mauve, the purple vein, which is the deep vein, and then there is the blue one, which is the vein that contributes to the problem of varicose veins and chronic venous insufficiency. So when the valves, this shows a competent valve, and the competent valve in the open position and the closed position. So in the closed position, it will not allow the blood to come back. But when it's incompetent, like in this case, the vein dilates and the blood begins to come back. Once it comes back, then it increases the pressure, which damages the next set of veins coming down. And this becomes like a cascade that goes down and damages the entire group of valves in that vein.
Okay. Well, we're going to actually do the doctor is going to do an ultrasound on someone and show you exactly how that works. We're here at the Vein Center in Ocean Springs. Now, tell us about this patient's legs.
Thank you. This lady was kind enough to volunteer to show us her legs. She has already had one leg treated, and you can actually see that there is this lipodermatosclerosis, which is an advanced stage in venous disease. You can see some of the veins are bulging under the skin over here, and the whole thing connects to the great venous vein that connects at the very top with the deep vein.
Right.
So now we're going to show you how a vein has been closed, and we'll show you the other side with the vein still open.
Okay.
So let's go.
So do that little ultrasound goop going on there?
Right, and we always do it in the standing position, because the vein will go down to a quarter of its size when the patients lie flat.
Ah, okay.
All right, so if you don't mind, go a little further out there, and don't worry, a bit more.
And again, this gives you a better view.
Right.
Of,
so this is the deep vein over here. You can actually see it.
right.
And this is the vein that we treated, and you can see it's closed now. Okay, I can see it's closed. When I put the light on it here, it does not light up, which means it's closed. Compare that with what happens here. You can see a lot of lighting up. That's flow. Okay, so as we go down further, you can actually see in the leg over here the vein, the branches of the vein which have not been treated yet. You can see actually how the flow goes to forward and backwards.
Right.
And that obviously means that the vein is going to dilate because there is increased pressure inside it.
And of course, having increased pressure, that's going to cause more
That's
health
right.
problems.
That's right. And if you look further down here, you could see there the constitution of the fat is abnormal. This is what we call lipodermatosclerosis. There is a lot of fibrous tissue that's building up because of this very advanced stage of back pressure.
And that cuts off the circulation?
It can cause clots, and eventually, obviously, that can go into the deep vein and to the lungs and cause problems. And you can see over here how the veins function. Now we'll go to the other side that has not been treated. If you don't mind changing that and change your position again, please. And we'll go to the other side and show you. Again, we'll go to the very top. And this is the deep vein. You can see that. And that's the artery here pulsating away.
Right.
And that's our vein over here. So that's our vein. And you can see.
A little bit better blood flow.
Yeah. All right. So as we go further down, we go to the middle here, and you can see the vein. Now, this is nowhere as bad as the other side.
Right.
In fact, this is a good vein here. So we may not need to treat that particular vein because there is no backflow, only a little backflow.
Right.
But I think she is communicating with perforators over here, which are short, stubby vessels that connect between the deep system and the outer system, and that's the one that needs to be treated. So
I guess it really depends. We're about 30 seconds left here, Doctor. It just depends on each individual one. They can come in here and get for a consultation, and you do an exam on them and find out exactly what needs to be done.
Absolutely. Every person is individual, and everybody has a game plan to be treated, and no two people are exactly the same.
Okay. Well, if you want some more information on that, what you need to do is give the doctor a call, or call here to the Vein Center. They're located right behind the Ocean Springs Hospital in off Highway 90 in Ocean Springs. You or someone else knows this. Get yourself some relief here from the Vein Center.